Hi friends, I'm Dr. Nitin Dhepe, Keloid Specialist, Skin City, Super Speciality Laser Institute. Today we'll see what is the keloid stabilization and what are the trigger factors in the keloid. Keloid is a spreading condition, so it's a spreading scar. Any injury, body heals with a scar. It deposits a collagen. But some people, they have defect in the healing mechanism. So for a small wound, body keeps on depositing more and more and more collagen. That is really keloid. So, and this deposition is not limited to the area of initial wound. It keeps on depositing the collagen in the adjacent area, so it grows wider and wider and wider. So this spread we need to stop. It's very difficult to stop the spread with the creams or tablets or injections or even with the machines or sprays and the lasers. So if we can stop that spread of the keloid and make it flat, that is called as stabilization. And once you stabilize, stop the growth of the keloid, that should stay stabilized for next couple of months, couple of years. So various treatments have different rates of stabilization. Previous treatments say using the creams. There we classify good creams and the bad creams. If you use a steroid, that's a bad cream. That's a very short stabilization rate. The keloid becomes little bit flat, better, and soon it starts growing again back, and you can get a new keloid in the periphery. Why? Steroid creams will induce new pimples, hair root infection, that's folliculitis, and you get a new keloid. Instead, the silicone are better. Injection again will cause a new infection, new keloid. We have seen that in the last video. So the stabilization rate of all the older treatment like the steroid creams, steroid injections, surgery, all that, an average success rate, average stability rate was around 12 to 15%. So 1 or 2 out of the 10 they get better with this treatment, and more than 80% of the patient, more than 8 out of the 10, they start growing the keloid back, even it is grows much worse. So the stability rate of all the old treatments was less than 20%, it's 12 to 15%. Now the newer protocols where we combine good lasers which modify the collagens, we combine the keloid chemotherapy, we combine the good creams, maybe some other good practices, and management of the trigger factors. All this together gives an excellent stability rate. In our study in Skin City, with our experience of last say around since 2008, we have designed a combination protocol using all these treatment modalities where stability rate is around 60 to 70%. So all the older treatment, only 1 or 2 out of the 10 they get better with the treatment. In our combination laser protocol, 6 to 7 out of the 10 they get better, they become flat and they remain stable, they doesn't grow back early. So it is a much better treatment, it's a much more effective treatment, but still it is not 100% because there is a lot of research still has to happen in the keloid. We really exactly don't know what is the exact trigger, what exact mechanism. So there is a lot of research already going on all over the world. So whatever the small research what we made, we could achieve a stability rate of 60-70% in our study. So combination treatment is effective. It is much more effective than whatever the old treatment what we use like the sprays and the laser and the injections and the creams and the tablets. So this combination laser protocol is a much better effective, it has a much higher stability rate, but still it is far from the 100% or any magic or miracle. So friends, if you have a realistic expectation, you really understand what is possible with the treatment and what is not possible with the treatment. So this laser combination protocol is a very effective treatment, and much better treatment may come in the future.